Have you ever wondered if something millions of adults consider a normal part of their intimate lives could carry a health risk that almost no one talks about? What if one common infection, often invisible and symptom-free, could, in rare cases, increase the risk of a type of cancer years later? The surprising part is that many people have never heard about it until it's too late.
Today, we're diving into one of the most misunderstood topics in sexual health. Can oral sex cause cancer? The answer isn't as simple as yes or no. The real story involves a common virus called HPV, how it spreads, and why understanding the facts could help protect your long-term health. Stay with me, because one of the biggest myths about this topic might completely change the way you think about it. Let's start with the most important fact. Oral sex itself does not directly cause cancer. However, it can transmit certain infections, especially the human papillomavirus, better known as HPV. Some types of HPV are considered high risk because persistent infection with these strains can increase the risk of developing cancers of the throat, tonsils, and the back of the tongue, collectively known as oropharyngeal cancers.
Here's what surprises most people. HPV is incredibly common. In fact, most sexually active adults will be exposed to HPV at some point in their lives. The good news is that in the vast majority of cases, the immune system clears the virus naturally within 1 or 2 years, and the person never develops any health problems. Only a small percentage of persistent infections with high-risk HPV types may eventually lead to cancer, often many years later. This is why awareness matters, not panic. One of the biggest misconceptions is that only people with many sexual partners are at risk. While having more partners can increase the likelihood of exposure, HPV doesn't discriminate. Even individuals with relatively few lifetime partners can become infected. Since HPV often causes no symptoms, many people don't realize they've ever had it. Imagine carrying a virus for years without feeling sick, only to discover decades later that it contributed to a serious health condition. That's exactly why doctors have become increasingly focused on educating the public about HPV-related cancers. Over the last 2 decades, researchers have observed a significant rise in HPV-related throat cancers in many countries. Interestingly, this increase has occurred even as smoking rates have declined. While tobacco and heavy alcohol use remain major risk factors for head and neck cancers, HPV has become an increasingly important cause of certain throat cancers, particularly among middle-aged adults. But here's another fact that often surprises people. Not everyone infected with high-risk HPV develops cancer. In fact, most never will. Cancer develops through a complex process that usually takes many years. The virus has to persist in the body without being eliminated by the immune system. During that time, it may gradually cause changes in cells. These changes can eventually become cancerous, but this progression is relatively uncommon compared with the huge number of people who are exposed to HPV. So what determines whether someone clears the virus or develops complications? Researchers believe several factors play a role. Smoking can weaken the body's defenses and damage tissues, making it harder to eliminate infections. Excessive alcohol use may also contribute. A weakened immune system, whether due to illness or certain medications, can reduce the body's ability to control HPV. Genetics and other biological factors may also influence risk. This means that 2 people exposed to the same virus can have very different outcomes. Here's where another myth needs to be addressed. Some people assume that if they have no symptoms, they have nothing to worry about. Unfortunately, HPV infections are often completely silent. There may be no pain, no sores, no fever, and no obvious warning signs. That's why regular medical and dental checkups are so important. Dentists and healthcare professionals can sometimes notice unusual changes in the mouth or throat that deserve further evaluation. Now, you might be wondering, if HPV is so common, should everyone be worried? The answer is no. Most infections never become dangerous,
But understanding the risk allows people to make informed decisions instead of relying on myths or misinformation. There is another question that many people are afraid to ask. Are there warning signs if cancer does develop? The answer may surprise you because some of the earliest symptoms are easy to ignore. A sore throat that won't go away, difficulty swallowing, persistent hoarseness, a lump in the neck, ear pain without an obvious ear infection, or a mouth ulcer that doesn't heal. Many people dismiss these symptoms for weeks or even months, assuming they're caused by allergies or a minor infection. In the next part, we'll explore these warning signs in greater detail, discuss how doctors diagnose HPV-related throat cancer, reveal one of the most effective ways to reduce your risk, and explain why prevention may be far easier than treatment. You won't want to miss it. One of the challenges with HPV-related throat cancer is that it often develops slowly. In its early stages, symptoms may be subtle or even absent. That's why paying attention to persistent changes in your body is so important. If you experience a sore throat lasting more than 2 or 3 weeks, persistent difficulty swallowing, ongoing hoarseness, unexplained ear pain, a lump in your neck, or a sore in your mouth that refuses to heal, it's wise to consult a healthcare professional. These symptoms do not automatically mean cancer. They can be caused by many much more common conditions, but persistent symptoms deserve evaluation rather than being ignored. Doctors diagnose these conditions using a combination of medical history, physical examination, imaging studies when needed, and specialized procedures such as endoscopy or biopsy if something suspicious is found. Detecting cancer early often improves treatment options and outcomes. Now, let's talk about prevention. One of the most effective tools available today is the HPV vaccine. Originally introduced to reduce cervical cancer, research has shown that HPV vaccination also helps protect against infections caused by several high-risk HPV types that are linked to other cancers, including many HPV-related throat cancers. Public health experts recommend vaccination according to national immunization guidelines, ideally before exposure to the virus. Another important step is practicing safer sex. While no method completely eliminates HPV transmission, using barrier protection during sexual activity can reduce the risk of spreading many sexually transmitted infections. Limiting tobacco use is equally important. Smoking doesn't just increase the risk of lung cancer, it also damages tissues throughout the mouth and throat and may reduce the body's ability to clear HPV infections. Maintaining a healthy immune system also matters. Regular exercise, adequate sleep, balanced nutrition, stress management, and controlling chronic medical conditions all support normal immune function. Although these habits cannot guarantee protection against HPV-related disease, they contribute to overall health and resilience. Let's clear up another common misconception. Some people believe that only women need to worry about HPV. That's simply not true. Men can acquire HPV, transmit it, and develop HPV-related cancers as well. In fact, HPV-associated throat cancers occur more frequently in men than in women. Awareness is important for everyone, regardless of gender. Another myth is that someone can tell whether a partner has HPV simply by looking. Unfortunately, that's impossible. HPV infections are usually invisible and symptom-free. This is one reason why honest communication, regular healthcare, and evidence-based education are so valuable. It's also important to avoid unnecessary fear. Hearing the words HPV and cancer together can be frightening, but remember the bigger picture. Millions of people are exposed to HPV every year, and the overwhelming majority never develop cancer. The goal isn't to create panic, it's to encourage awareness, prevention, and early medical attention when symptoms persist. Medical science continues to improve our understanding of HPV-related cancers. Better vaccines, earlier detection, and more effective treatments are saving lives. The more informed people are, the more likely they are to take practical steps that reduce risk. So, what should you remember from today's discussion? First, oral sex itself does not directly cause cancer, but it can transmit HPV, and persistent infection with certain high-risk HPV strains can increase the risk of developing some throat cancers in a small percentage of people. Second, most HPV infections are cleared naturally by the immune system and never become cancerous. Third, persistent symptoms such as a sore throat that doesn't improve, difficulty swallowing, unexplained neck lumps, or lasting hoarseness should be evaluated by a healthcare professional. And finally, prevention matters. HPV vaccination, when appropriate, avoiding tobacco, practicing safer sex, maintaining regular medical and dental checkups, and seeking medical advice for persistent symptoms are all practical steps supported by current medical knowledge. If you found this information helpful, share this video with someone you care about. These conversations can feel uncomfortable, but they can also help replace myths with facts and encourage people to seek medical care when it's truly needed. And if you want more evidence-based health information that could help you protect yourself and your family, subscribe to the channel and turn on notifications. We're committed to bringing you clear, reliable medical insights so you can make informed decisions about your health, because understanding the facts today could make a real difference for your future.